Dr. Flavia Bustreo. I am Italy's candidate for the Director General of the World Health Organization. Thanks for that important question. First, let me say that as Assistant Director General for the Family, Women and Children Health, I had the opportunity and privilege to play a leading role in arriving at the definition of that plan of action that you mentioned. And that took us 2 years of very hard work of negotiation with countries, civil society organizations, member states, and led also to a very historic first resolution at the World Health Assembly in 2016 that is committing countries and member states to take action to address the issue of violence against women, against girls, and in particular against children. And hence, having led that work, as Director General, we want to finish it. We want to see it at completion. And for me, it will be very important to stress also that the actions that are included in these action plans address the capacity of the health system in terms of the health worker capacity to address and care for children that are affected by violence, addresses the capacity of the Ministry of Health to plan for these responses, and also addresses the financing and the working with partners within a country. And one last thing I want to say, or what I will do, is that I will put a lot of stress and emphasis on accountability, because within the plan there is a commitment for the Ministers of Health to report every 2 years at the World Health Assembly on the action that they have taken. And I will be very forceful in looking at what has happened in the different countries, what is not happened, and how can we make sure that this plan doesn't stay a plan, but it becomes the real action that affects the life of children. Well, I will tell Honorable Minister, you really have to realize that violence against children is really an hindrance on the health of those children. It puts a burden, a terrible burden for the future life, and therefore the response that the health system provides has to be included in the comprehensive package of addressing children's health, children's well-being and children's development. And therefore it has to be within the National Health Plan, and it has to have that focus especially at the community level and especially on the healthcare service provider. As I worked in Khartoum in Sudan myself, I've seen the terrible impact that violence against children can produce, and how very often healthcare providers are not equipped with the right skills and the right ability to cope, to counsel the family and to work with the community. And I will also tell the Minister, please work with the civil society organization, with the partners on the ground that are very capable, that are very able to help you. And I will also advise, please work with the financiers that enable you to really look at the financing for the actions that are required.